Welcome to Peace of Mind for Pet Parents, the podcast by Brighthaven Caregiver Academy. I'm Gail Pope.
And I'm Karen Wylie. And together we're here to support you in navigating life with your aging or ill pets. We know how deeply you care for your beloved companions, and we're here to offer guidance, understanding, and resources for this meaningful journey.
Each episode, we'll explore topics that address the daily challenges, emotional realities, and choices you face as a pet parent, helping you and your pets find peace, comfort, and joy. Whether it's making sense of a new diagnosis, adjusting to changing needs, or simply seeking a place to feel understood, you're not alone. Thank you for being here with us.
Hello, and welcome back to Peace of Mind for Pet Parents. I'm Karen Wylie, here as always with Gail Pope. Today, we're going to talk about an issue that seems to be affecting a lot of pet parents out there, and that's how to protect your hospice journey with your pet when you need emergency veterinary care. Over the last few months, we've heard from pet parents who described feeling uncomfortable when they were in emergency situations at the emergency clinics. Some have said they felt there was pressure to euthanize rather than continue the comfort care at home that they were providing. One pet parent described being refused any pain medication from the vet at the ER, and they were encouraged to find another clinic or another vet to do that. And one even called Gail from their clinic to say that they were being told they were not allowed to leave with their pet because they were refusing euthanasia and were instead wanting to take their pet home. So, Gail, you and I have worked with enough vets over the years to know and trust that they're doing their best and they're recommending what they really do believe is in the best interest of the pet.
Yes.
Sometimes also the client, even though the pet is their focus rather than the pet owner or pet parent. But when a veterinarian's perspective is different from the pet parent, especially in an emergency room where the vet has no prior relationship with the pet or its owner, there are different communication approaches that need to be considered and used. So we'd like to help you prepare for those situations so you can stay true to your hospice intentions with your pet, even when you are talking with veterinary professionals who may not understand or support your choices. Gail, what do you think of this situation that pet parents can find themselves in, or that any of us can find ourselves in?
The first thing to say is it's absolutely heartbreaking. I've been there a couple of times in the past, and so I completely understand. It's difficult to think clearly when you're in a state of panic, obviously. And I think one thing to say is that this doesn't actually happen very often, because if you're working in hospice care with a hospice provider, if you have a team of people, which is wonderful, but if you have someone who's experienced at hospice that you can call and talk through what's going on first, sometimes it isn't an emergency. And sometimes you can alleviate that problem. But other than that, basically, it's getting a hold of yourself, taking a deep breath, knowing you're doing your best, and moving forward and following the protocols that the hospital has.
Definitely, the culture of an emergency clinic is very different from your clinic around the corner or down the street. You can feel it from the minute you walk in the door.
Yeah.
So there's always different procedures. Let's talk just a little bit about why this is happening, because there are several different changes taking place in the veterinary field that can be affecting how emergency vets are viewing the pets that come in. The first thing that I thought of is how different emergency care is now compared to how it used to be. There was a time, I'm going to say, even 5 to 10 years ago, I would say it was still the case that if you brought your pet to an emergency clinic at night or a weekend when you couldn't see your normal vet, the emergency vet saw themselves as a bridge back to your regular vet. They were very clear about finding out who your vet was and the contact information, because they were going to make sure that the pet was back to your vet by Monday and that the records were coming in. So they saw themselves in a different role than what appears to be now. Of course, I'm in Appalachia, you're in California, outside a big city. So we have two very different geographical areas. But I remember the old days when the local vets would enter into a collaborative agreement with one another. Let's say there were four of them that agreed to work together, and each one of them would take a regular weekend so that each of them would have 3 weekends off, but all their clients could be served by leaving an outgoing message on their phone that such and such a clinic was covering emergencies this weekend. That was how it was probably for the first 20 years or so that I lived in North Carolina. That was
Very old-fashioned tradition.
very old-fashioned tradition, and it's really only about 15 to 18 years now that we started having actual emergency clinics that were separate from ongoing and taking turns being the emergency vet on call for a weekend. Now there's even regional emergency rooms that have all the highest, best equipment. A lot of the clinics also have the new economic pressures if they're owned by new corporations that are specializing in purchasing veterinary clinics. That's up to almost 40% of veterinary clinics now are corporate owned. So usually there's a big investment in state-of-the-art equipment and a little bit of pressure to use it with pets that come in. So those can be factors in how emergency veterinary care is changing. What are you seeing, Gail?
Actually, I'd love to really enlarge upon what you've said. I'm touching wood right now on my desk because I have not been to an emergency clinic in quite some years. But yes, I certainly remember the old-fashioned ways, and my own clinic was like that. We had arrangements with other clinics. However, my local vet here now, they don't have an arrangement, but we have the traditional emergency clinic that serves our area. They've been working for a long time. They were working when Brighthaven was still a sanctuary here. They were great. Looking back at the reception that I had there, they were unhurried. They were doing their job. They were very focused, but they weren't being pressured by time. I think a lot of that is a problem now that vets in normal practice as well as ER practice, they're overwhelmed and they are very cautious about how much time to devote. I also think as well, when you have an animal in hospice, that we're lacking an awful lot in education in that area. I think when we're at vet school, we're taught how to save a life. We see a symptom and we treat it. However, when you're getting towards the end of life, it's a different situation. And again, as I've experienced over the years, animals who are doing well in hospice care don't generally end up in an ER, which is why I always give my telephone number to my clients and say, if you have something that worries you, that you're really just not sure what to do with in the middle of the night, please call me, because I'll be the first one to say you need to go to emergency if you do. But in hospice care, there are often signs and symptoms that may not be an emergency, and knowing those is very valuable. In fact, I think we have a handout, don't we?
We have several.
So I think the more the vet knows is helpful, but they don't really need to, because hospice care isn't their line. They are emergency and they're dealing with emergencies. Sometimes yours may be the number one emergency of the moment, or there may be 5 or 6 other clients who are already there that have something that is more life-threatening at that moment. It's heartbreaking, and it's never the loveliest thing in the world to have to go to an ER clinic. But the people that work there are so talented. They're so well trained at their jobs. And it's just so lovely to see the efficiency that they have in ERs.
There's one ER in particular that I have been working with, I guess, 15 to 18 years. Need to look back on it. But I got email from them earlier this week that they just wanted me to know that they were going to be unable to provide 24/7 emergency care until October 1st. So they provided, the shortage of vets. They were not able to staff it. So as they ethically should, of course, they were providing the names, locations, and contact information of the other emergency vets 50 and 75 miles in other directions. But that's also a factor these days, that the clinic that you go to could be understaffed, and that could be affecting how they're able to work with you, especially if it's a situation where they're often evenings and at night hit and runs and animals that have been poisoned. So depending on what's going on with you, they may not judge you. Putting you and your animal through the triage questions, you may not be considered the highest priority. Let's turn our attention to what pet parents can do in these kind of situations to protect themselves and their pets in terms of being able to advocate for themselves and stay on that road of providing comfort care, if that's the goal. So there were three things I wanted to suggest just in terms of preparing before you take your pet to an emergency clinic. That is, first of all, to assemble any receipts or lab work that you have from your vet that you typically take your pet to see. Bring your pet's list of current medications. If you bring that, that does communicate that the pet is being seen by a regular vet on a regular basis, and you will probably be viewed differently than if you arrive and you have no paperwork and there's no history. Then they're worried and wondering what context there is for this pet. A second thing I would recommend is to research the emergency rooms in your area in advance and actually call them during non-emergency times, which is usually daytime as opposed to evening or overnight. But just ask, do you support comfort care for pets in hospice? Yeah. Sometimes they might not know, and they say they have to find out, but you might get your answer by the way they respond. And you might share their philosophy of how they view the pets that come into the emergency room. And the third thing is to actually prepare something in writing about why you're there. You could give this to the receptionist at the front desk, where you're literally saying, if Fluffy is receiving hospice care, our goal is comfort and quality of life. We are seeking comfort-based treatment only. They wouldn't be used to getting something like that. That would be something that would be communicated to the vet. We'll include more suggestions for that kind of statement in the blog post that we'll do related to this conversation. But what do you think, Gail? What other suggestions would you have for pet parents?
I think the first one related to what you were talking about would be when you experience an emergency happening, the first thing to do is to actually identify. I know I have a list of our local emergency clinics on the side of my fridge. And the first thing I would do is go straight to that, pick the nearest one and telephone them and say, I have an emergency, I'd like to come in. Can I come now? Because I know, in fact, 2 years ago when we moved here, I had an emergency. I'd forgotten all about it. It's interesting how these things come back to us, isn't it? I had an emergency with our dog Ziggy, and I didn't call. I panicked, and I got in the car and we drove Ziggy to our nearest ER, and they turned us away because they were too busy. They recommended another ER. We drove there, and they said they were too busy and couldn't help us. So that taught me a real lesson. Call them first and find out. And then the other lesson, which is one we all know, and I could preach to myself too, and that's panic. Because when something happens, you don't know quite what it is, how to deal with it, you need help. You don't stop to think clearly. It's almost impossible for us as humans to do that. So we panic and we go into overdrive, which is quite good in many respects because we get very focused and this is where we're going and this is what we're doing, and that's wonderful. However, when we arrive, we have to take a deep breath and let it go, because when we are in that mood, I think we can be perceived as aggressive sometimes, or bossy, or no, I can't wait that long. We tend to start arguing because we're in a panic. Sometimes that doesn't go down well, especially when you're actually with the veterinarian. This is the area that I'm used to. When a vet has said, there's nothing more that we can do, I'm recommending euthanasia. Now, at that time, most vets will suggest, if the animal's stable enough, to take him home, think about him, take him to your regular vet tomorrow. The problem has come occasionally when the vet says, I think we need to euthanize now. the pet parent is just completely flawed and unable to really discuss it sensibly with the veterinarian to discover whether or not they could bring him back tomorrow morning. They could talk to the family. They could just take a few hours. Does he need oxygen or a reason that he would have to stay there to be kept alive? Find out a little bit more, center themselves, and just remind themselves the same old thing. I'm doing my best, doing it with love. We're together in this. But making your veterinarian your friend and your ally, to me, is the most important thing because they see you as a human being, as a friend, rather than a client who's being difficult.
That's easier to do with a vet that you see all the time. Whereas at an emergency clinic, that's one of the reasons why I had my favorite and I tried to go there all the time, because I had a lovely file of all the different animals over nearly 20 years.
Yes.
Where I was tried to be a good client, but you're still seeing a new vet for the first time. And like you're saying, they may not be comfortable with comfort care. They may be unfamiliar really with what hospice care is all about. They're just recommending euthanasia because that's something they can do. They know that can offer relief at various times. So I know that you have often encouraged pet parents to use time as their ally and how to buy themselves some time.
Yes. It's always different. Euthanasia in an emergency situation may be completely appropriate. However, in end of life care, it may still be appropriate depending on the circumstances, but it may also not be appropriate. So, yeah, there's a gap there, both sides. The more we all learn, and the more we just practice being kind. Loving kindness is the important thing because then we can have proper communication. If it is the right thing to do, we're never going to be comfortable, but we can feel that we did the right thing. And the vet also can feel empathy and
Yes.
understanding, and we part friends.
I think, at least in most cases, I'll just speak for myself. If I'm bringing a pet in for an emergency, I have a good understanding of whether euthanasia is probably on the table, or I want their input and I want some supportive care, but I'm planning to bring my pet home. So in those cases, I would encourage pet parents to just say, we need to take our pet home tonight to discuss this with our family, or we'd like to consult with our regular vet before we make this major decision. I think those are very valid reasons to say, no, I don't want to pursue euthanasia this afternoon or this evening. The relationship you have with your vet can really be a shield for you, because you can say to the emergency vet, Dr. Smith knows our pet's history, knows everything we've been doing, and we'll be discussing this with them. That can reduce the pressure in the conversation with the ER vet, because again, they know your pet is under regular vet care and that it's not all up to them to take care of the situation.
It all depends how much of an emergency it is. If they can
Yes.
get the symptoms under control and give you medicine that you might need to tide you over while you go home,
Right.
then that's wonderful. But sometimes it isn't possible, and we do have to make urgent decisions. It's heartbreaking and terribly tough.
It is. And in those situations where you don't want to euthanize your pet and you want to go back and see your regular vet tomorrow, know your rights. You can refuse the recommendation for euthanasia. You can request your records from the ER. I have heard in at least one situation where pet parents have been asked to sign something because they're leaving against medical advice.
Yes.
So that's also something you can do. Then take your pet home and see your regular vet tomorrow.
It's the same thing as in the human world. We would have to sign it the same way.
Exactly. And the idea that a clinic or a veterinarian would say that you can't leave with your pet, it's sad to say this, but pets are considered property and they are your property. So don't ever feel pressure. It's easy in those situations to feel pressure and that you don't know what to deal with. Think through your exit strategy and have a list of other emergency rooms or mobile care vets that could come to your home. That's where the list, Gail, that you were talking about, checking on the refrigerator to see where else you could go would be important. I guess we can close this conversation because we've identified some strategies of how to cope with this situation, and we will have more ideas and suggestions for you in the blog post that'll come out this week on the same topic. So in closing, Ms. Pope, what would you like to say?
It's a difficult and sad topic for both sides of the table. Again, to me, it's all about loving kindness, taking a deep breath, being centered, staying calm, and it's all for the animal. It's all for love. Love sits under everything. I think when you can have a sensible and warm conversation surrounding a difficult issue, then you're going to make the best choices.
And like we said when we were starting out, everyone's got the best interest of the pet in mind.
Yes.
It's just their recommendations or suggestions may be different from what you want to do and what you want to follow. You as the pet parent know your pet best. So that's always something to rely on, is your knowledge of your pet and the relationship you have. Remembering to prepare before you need emergency services with several of our suggestions today. It's important that you have that list of ERs and their phone numbers that you've already mapped out at a time when you weren't in a crisis. You don't want to have to do all that research while you're in a crisis.
If I may,
Yes.
the one thing that just really came into my mind is that when you are working with a trusted hospice provider for your animal or for your human, then your animal is generally in the last chapter of life and heading towards the end of that life, but it's not generally filled with any or even one emergency.
Right.
We don't see emergencies because the trajectory to the end of life becomes balanced in hospice care. Mm-hmm. So hopefully it won't happen to anyone, but it's always something to consider.
Absolutely. Emergency vets have been trained to do things. In hospice care, we encourage everyone to be with their pet. So we already have different approaches, but they're both valid and both needed because the goal is to do what's best for the pet.
Exactly.
And this kind of situation that we're describing can be difficult for even the most experienced hospice caregivers. So don't be down on yourself if you're uncomfortable with it yourself. Absolutely. Then we'll close this conversation. And thank you for being with us today. We hope some of these suggestions have been helpful to you. And we hope that we will see you again next week on our podcast. Thank you. Bye-bye.
Thanks. Bye-bye.
Thank you for joining us on Peace of Mind for Pet Parents. We hope today's episode has offered you support and insight as you care for your aging or ill pets.
Remember, it's not just about the end, it's about living well at every stage of life. To continue your journey with us, explore more resources at Brighthaven Caregiver Academy's website, brightpathforpets.com, where you'll find guides, assessments, and a caring community of pet parents like you.
Until next time, may you and your pets find comfort, connection, and peace in every moment. Take care.